Can you hear me now? Can you hear me now?
Welcome to the ScreamingBox interview series with Imin Carr, guest Tony Ma, Benten Technologies.
Welcome to ScreamingBox. My name is Imin, and we are here discussing the technology and business with Tony Ma. Hi, Tony. How are you?
Good. Thanks for having me on.
100%. So, Tony, tell us about yourself.
Okay, so I am Tony Ma. I am actually a co-founder of Benten Technologies. Benten Technologies is what you might call a social impact company. We have a product that we're building, a platform of digital therapeutic products. And so, from that perspective, our mission is to democratize healthcare and address health disparities. We have what's called a big, hairy, audacious goal, or BHAG, or big, hairy, audacious goal is to impact 1 billion lives. And so, from that perspective, if you know the US Census, there isn't 1 billion people. So, for us, that means global health and impacting 1 billion people. And so we do that based on 3 pillars. We believe that if we leverage 3 things, the 3 pillars that define us: time, technology, and education, then we can democratize healthcare and address health disparities. So that's what drives us. I also am a recovering management consultant. First half of my career, I basically did a lot of consulting, first in commercial, then to federal, then to state. So that's why I say I'm recovering. So a lot of background there. Now I'm on my second half of my career. I might look young, as some Asians do, but getting really close to the big 50, getting a little scary there, but I would say I feel like I'm forever 21, but my body's definitely breaking down, wearing a lot of glasses, possibly reading glasses in the near future. So excited to be part and share my experience or answer any questions as part of this.
Okay, so how did you transition from like you said, you were consulting, now you started this completely new thing with the healthcare. So how did you come up with this idea from consulting?
So originally, I always have been an entrepreneur ever since I was even a little kid. From mowing the lawn to liberal. A bunch of different little side projects, little gigs. I remember being in 6th grade and stealing packets of noodles from my parents, and then going to school because kids like those noodles, and so I would resell them for quote unquote a profit, because I would sell them for like 50 cents. So I was always entrepreneurial minded. And so once I graduated from school, I went into management consulting. And so short after doing some stint in some other areas, including some startups. So prior to going into management consulting, I actually worked in the .com. So I started my career in the mid 1990s, which was when the .com era happened. So I had a rocket ship trajectory and transitioned quickly from working from a internet company, actually, that helped form the backbone for the internet. I worked for a company called UUNet, and UUNet basically built the backbone for the internet as it is today. I mean, a lot of it out of Ashburn, Virginia, and stuff like that was started there. I don't know if you know the history of UUNet, but basically it got acquired ultimately by WorldCom, MCI, and the Bernie Ebbers story, for those that are familiar, and crash and burn. So, I had a very, I guess I would say, a rocket ship career. The first 4 years of my career, my salary would double every year for the first 4 years. Had like a close to $1 million stock portfolio. Thought I was going to retire at the age of 40. a lot of different things, and then continued that career in management consulting, where I traveled the globe, all the way to Singapore, Taiwan, California. So it was a jet setting life for a while, doing a lot of managed consulting to C-suite, top level executives, people, VIPs, CIOs at various companies, strategy projects that were like anywhere from like $10 million to $250 million, doing their strategy and some of their integration pieces. And then I guess after a while, making projects successful, but then at the same time, feeling, I guess, jaded and I guess not really fulfilled. At first, it was fun. I mean, the challenge of it, as always, is novel and trying to be successful and executing. Had a success in those areas. Was successful to help various VP CIOs either delivering projects successfully, in some cases modifying the strategy because where they were going was going to be a dead end. So really supporting them, and so, but after a while, what ended up happening is you get jaded and you're just like, what am I using my superpowers for, and not being fulfilled. So probably about a decade ago, I we pivoted. 12 years, I pivoted the company really around that time, met my wife, had my first child, and said, I want to leave, do, I guess, the second act of my career slightly different. And so that's kind of where that pivot happened.
Great. Yeah, I do read that you said that it's a social impact company.
Yes.
Could you like explain it to us? Like, how do you like say like how do you come up with that? Like, how does it impact socially?
hmm So I think throughout my career, and I guess different parts of my life, I've always been impacted by different things. Even like, for example, I remember before even starting my career, I was I used to sell books as um, my I guess freshman year in college. I went door to door to sell books for a company called Southwestern Company. And so what ended up happening there is it was pretty interesting because they were selling books to low income neighborhood. I was selling into neighborhood near Van Nuys, which was really run down. It was pretty bad actually. Some of the neighborhoods that I would go into, I remember one of the neighborhoods when I went knocking on the doors. There were like little black spots on the houses, on like two of the houses, and I was like, oh, what are those black spots on the houses? And they said, oh, a drive-by shooting 2 weeks prior. So from there, the neighborhood really did have that, and it was mostly Hispanic neighborhood. So I went door to door and selling books, and I remember one time meeting a gentleman at one of the houses. He saw what I was doing. Of course, you don't throw gang signs and stuff like that. I went and talked to him, and I sat down and was sharing some books. He didn't let me in the house, so we sat on the sidewalk. So I was like, I'm selling books and stuff like that, and he said, "Oh, those are very interesting. I would love to buy it. Why don't you come back at the end of the summer?" And I might buy them from you. I said, sure. Of course, as a salesman, you never really say no to any sales. But of course, a little bit of his backstory is he had just been released from prison 2 weeks prior, right? So from that perspective, but again, what I guess left an imprint was that he still wanted that something more for his kid. So that's one of my pillars, right? Education. So I did go back at the end of the summer, but of course he wasn't there. But again, that left the impression on me of everybody may not be born with a silver spoon, or might not have the right circumstances, but they all want the best for their children. So from that perspective, that was like one of those points. But back to your question, there were other indelible moments. I'm just giving you one example of that. So I guess I've always wanted to help people and stuff like that. I've traveled and been to places around the world where you see the have-nots, right? And actually, my origin story is from that. I was born in a third world country, Vietnam, during the Vietnam War. I won't get into that in this, but basically, I know what it is to not have. And so when I came here and had all this success and realized I guess it wasn't fulfilling, that I said, okay, how can I use so that was the genesis of the social impact. And so what does social impact mean? Social impact means uh, being able to leverage my superpowers in the business world to really have an impact. So, actually at the time that I actually looked into starting a nonprofit, but I guess weighing that out, one of the things I realized is a lot of nonprofits, and by no means not important, is there's a lot of nonprofits doing a lot of great work, but I thought, okay, what does nonprofit mean? You create an organization, you're running the organization, and then you're just putting your hand out to receive fundraise from people, and that's always self-sustaining, right? And it doesn't really, and in some cases, in those types of nonprofits, right, it exists, and it almost, so I'm not saying that that's their intention, but I mean, they exist to really solve a problem, but sometimes it almost enables that problem. Whereas, from my perspective, and again, I'm not saying that's the case, but this is back a decade ago, and I said, okay, what about creating like uh, a for-profit company that is mission driven, right? Back then, before the term social impact, can we create a sustainable company that makes enough money but without putting greed first? And I think nowadays you hear terms like conscious capitalism and social impact. So that's what a social impact company is to me. A company that is for profit. You have organizations such as like Public Benefit Corporation. I think that started out of like California West Coast area, and then you have like a B Corp certificate, certified company. So we are actually going through the process of getting our B Corp certification, and so we want to look at having an impact and want to be measured by the impact, right? So that's in your charter, that's in everything that you do. And it's about conscious capitalism. You need money to sustain, and you want to create a sustainable company. And it also, you want to support the people, and you have that mission. But it's not about the fundraising anymore. It's about creating a sustainable company that supports the economy, that supports, and then that also drives. It's not about the greed. I mean, recently you heard cases. I mean, there's so many stories about greed and overpowering from like. I have a son that has peanut allergies, and I don't know if you remember this about 1 or 2 years ago, but the price of the EpiPen doubled, right? And nothing really changed in the formulation and everything, except somebody bought them, and then they decided to, I believe, increase the price by double, and that's outrageous, right? So I think there's a balance. It's okay to make a profit, but it's not okay to be greedy. Does that make sense?
That actually makes sense, yeah, 100%. So is it the reason too, like I was thinking, okay, like I'm 28 right now. So when you think about being an entrepreneur, you consider a lot of like options because healthcare itself has a lot of competition. There are a lot of things already coming. People are proposing, there are already established companies in there.
Hmm.
So how
Yeah.
did you like you said that you were like selling books. You basically had experience with a lot of other companies and other I would say categories, right? So how did you like decide just going with the healthcare instead of like have you I'm not saying like you would start something, but have you like thought about considering some other companies or like other than healthcare something?
I think, again, little experiences leave impression on you. So around 2004, 2005, I shifted from management consulting for commercial entities to management consulting for the federal government. So actually, one of the contracts that we got was to basically help launch a portal. It was a healthcare portal. Uh, this is early days for the Veterans Administration called My Healthy Vet. And so we were successful in launching the platform, and I believe the whole team and everybody worked together to help launch and get from 0 to 800,000 users within 1 year of the veterans. But and we had disabled veterans. We have different types of veterans that really supported and tested it, and it looked very positive. And there was definitely a much of a need. But what you saw also on the back end was how broken the system was. Shortly thereafter, there was a lot of scandals around the VA, and even to this day, every once in a while you hear about scandals and different things. I know people are trying to do their best, but it's a broken system, right? So that's why, so that kind of helped me say, okay, how from the inside working out, doesn't always work. So how about the outside looking in or looking at new innovative solutions? So that was another genesis or another point that really kind of was a turning point on why I focused on healthcare. Prior to that, it was internet, telecommunications, billing, CRM, stuff like that. That was my focus. But seeing the brokenness in the system, how kind of solidify. Then the second point is I also did go back and do a little bit more management consulting overseas. Had an opportunity in Taiwan, and so another thing that triggered the brokenness in the healthcare system was I had, as a management consulting, I had one of the best healthcare plans, and I remember this story, and I tell this all the time. So, they said, okay, you're traveling and you're going to work in Taiwan, so you better get. I think it was either Hep B or Hep C vaccine. And again, I had Blue Shield Blue Cross, one of the top premier insurer. I went to my primary care doctor, had to pay a $30 copay. All right. And he said, okay, I don't have the vaccine here. You have to go and get it from CVS. And I say, okay, good. So he said, there's a CVS right across the street. I write the prescription. You go and pick it up. And so I went over there, picked it up. Another $30 copay. Then I came back to him. I said, okay, I'm here. It's like, okay, since you left the office, it's considered a second visit. Another copay. So $90 to get one shot. Since there was an urgent need for me to be over in Taiwan and flying like that, I had to get the other, it's a 3-shot regimen. So I went over there and got my next shot. And then the following, I think it was like I was going to be there for a couple months and really enjoyed. So single at that time, so was open to traveling and just staying and exploring. And over there, Taiwan have their own healthcare system. And of course, my insurance was no good. The remaining 2 shots, no insurance, through their public and everything, $60. I mean, I didn't have to pay anything and stuff like that. And so that left an indelible mark on me. I was like, I'm paying hundreds of dollars every month, plus that. So there's something broken about our healthcare system. And of course, there's people can point to a number of things. So that's why for me, back to my pillar, right? How do you leverage time, technology, and education to democratize healthcare, right? Because you do want to lower the cost. You want to look at that. There's just bending of this curve that has to happen over time, because right now the cost continues to skyrocket. Even as a business owner, every year you're paying more and more and more into the healthcare system, and that's somebody that can afford that. Then you have people that don't, the people that are on Medicaid, Medicare, right? So there's a lot of different challenges, and so there needs to be solutions that kind of help drive down the cost. And so I want to be part of that. And so that's why I say time, technology, and education, because I think you can drive down costs. I think you can drive down components if you do some automation. I mean, once you code a robot that does AI and detects something, hopefully the cost goes down if that company's not greedy, right? So that's why I want to be part of that solution. My goal before I leave this world and die is to be able to have that impact.
That's right, exactly. That makes sense. Actually, that makes much more sense that how you came in healthcare because that was I was wondering like how did he thought about like coming into healthcare?
Hmm.
Okay, great. So what kind of technologies you're using? Like I do understand like about the services, like you talk about like that particular vaccine, the hepatitis like A C. Like how do you like what kind of technologies you are using, to make it like more better?
Hmm. So,
It's like
no
if I were
worries.
a room, my room light would go off.
Okay. Yeah,
Yeah,
yeah. I guess it's saving energy, so that's a good thing.
yeah, it does that.
Yeah,
Yeah, I remember.
only if you're not moving enough, then so. As far as technology, I've always been a lifelong learner and always reinventing myself and always learning. So I get, I tell my co-founder Katie that we pinch ourselves and we get to wake up every day working with some of the top minds in not only the country but in the world, right? And so the technology that we're looking at includes, artificial intelligence, machine learning. Of course, it goes back to my roots because, a lot of it was telecommunications type systems. So that's all telecommunication systems. You want to be able to leverage that, whether it's mobile devices to landlines to IVR systems. The list goes on and on. I mean, that's my background. I actually have a master's degree in telecommunications and computer networks. So that's where I got my master's degree in at a local university here called GW. And from there, that's one of the things that we focus on. And of course, with artificial intelligence, whether it's machine learning, AI, natural language processing to computer vision, those are the things that we're working with. I know enough to be dangerous, but I rely on the experts, right? A lot of times we put together what's called multidisciplinary teams to work together to solve a solution. And we also use a approach where it's community based, whether it's like a user centered design where we have a community advisory board, or moving more towards a community based participatory type research. We work with the community. We don't do something to the community. We do it with the community. So that's really kind of the different components. But back to the technology, it's anything. I mean, one of the things we're working on is like a smart speaker system. Jarvis for the home would be an example. So that has some NLP components. We're getting ready to start a project over in India. It's oral cancer screening, and so for the oral cancer, we're looking at computer vision. Oral cancer is not a big problem over here, partly because everybody goes to the dentist for most people, but in third world country like India, it's a huge problem, right? So because of the chewing tobacco and the smoking tobacco, so again, there we're looking to solve a solution, working with collaborators over there to really address that problem.
That's great. Yeah, awesome. So, like, you are definitely, it's not a non-profit company, so definitely your company needs to make some profit too. So, I was wondering, like besides, like, if you compare yourself with other healthcare companies, like, what are the challenges like you are facing? Because you wanna like fix the system, at least you're trying to fix the system, and at the same time you are making your company work too. So, what do you think? Like, what are the main challenges you are having in that area?
So I think with every company, you always have a great idea, and of course finding out what that minimum viable product is. So there's always the issue of how do you get to something that really fits, that can engage people. For us, another problem also outside of that is it evidence based? Are we doing something that really has an impact, right? So I don't care to be like a headspace or a calm, although meditate, but I want to show the impact, right? I want to be able to measure that impact, right? So as part of that, that's also a challenge. And so, especially in the digital health, and for us, we're trying to be more of a digital therapeutic product company. So from a digital therapeutic type thing, you also have to go through what's called clinical trials, right? Those you hear about that for the vaccine. So it goes through various clinical trials where you have like the gold standard is what's called a randomized control trial, where you have a control group and then you have an intervention group, and show that there is some statistical significant improvement in some area or some outcome. And that can take a long time to do that and get that approval. So that's ultimately the goal. And then it has to be based on science and evidence and hypothesis that you have. And this is where the impact would be, whether it's like decreasing the depressive symptom of a college student that is has depression. And of course, as part of that, you're working with possibly high risk populations. Like I said, like you could be working with college students that have depression. You could be working with moms that have depression. So there's that challenge of keeping them safe in a random. If something does happen, what happens in an adverse event, right? Just like this vaccine that you hear going on, what are the possible adverse events? Those have to be reported, and so that's what you're trying to do. And but ultimately, the goal is to say, I developed something that has clinical outcomes. I developed something that has been shown to improve or decrease something, whether it's death, depression, increase weight loss and weight, reduce weight retention. So it's a bunch of different things that you have to factor in, which makes it slightly more complex and more challenging. And I think, as you know, that's why I like the challenge, right? So it's not just to be a digital health company, right, consumer, but to be move more along the lines of being digital therapeutic, to have improvements in the human condition and healthcare. And that's how we can measure impacting a billion lives. It's not just them downloading the device and using it. Oh, there's impact. No, we want to show impact.
Yeah, well, that makes sense. Yeah, thank you so much, Tanima. It's gonna be a wrap up. So, is there anything else you want to share with us, like being a health, like you are an entrepreneur? So, anything you want to share with us, like for the, like future, like us, like if I want to think about something in the future, would you share or would you give me a suggestion, or is there anything you want to share with us?
Yeah, I mean, like all entrepreneurs, we also have to take care of ourselves, our mental health, and everything during the COVID times. It's definitely challenging, and of course, we are working in this new model of how people work. I mean, we were already exploring. I'll close with that, like remote work. But now, what's that new model look like as we go into this post-COVID? Hopefully, in the next, depending on what happens with the Delta variant, the boosters and everything. I have 3 little ones, but hopefully we're at the end of this, and so there's going to be a new economy, even for startups or companies, right? They call it the mass resignation, right? Where a lot of people, if people, you hear of what Apple's doing and people revolting. So I think that's something as entrepreneur you have to think about, because it's about the people and the processes. So what are we doing for the people? So I'll close with that.
Yeah, thank you so much. Thank you so much for sharing all the information and experiences. They mean a lot. Thank you.
No worries. Thank you. Thanks for having me. Have a
Uh,
good evening.
you too.
Thank you for joining us on this month's interview series. Please follow and subscribe to the ScreamingBox podcast to hear our monthly interview series as well as our monthly podcast. Until next month, stay safe and healthy.